Hello, everyone. This is Dana from NexGen. I am very excited on this Mindful Monday to introduce to you Dr. Iyantta Howell. Dr. Iyantta Howell is a double board certified child, adolescent, and adult psychiatrist with over 13 years experience working in a variety of clinical environments, including inpatient and outpatient settings. Additional information on Dr. Howell and Align Psychiatric Solutions is in the description below. Dr. Howell graciously agreed to sit down with us to discuss emotional wellness. Dr. Howell, thank you so much for talking with us today. I do have a few questions that I would like to ask. One of them is, what is emotional wellness and why do you think it's important?
Well, first of all, thank you for the invitation. Yeah, so that's a great question. Emotional wellness is, another term for mental health. I know everyone's kind of heard that, that phrase. It's defined in a lot of different ways, but how I like to define it is emotional wellness is basically a person's ability to have a healthy view of themselves and an accurate view of themselves, and not just of themselves, but of the world around them, which includes situations, people. So it's really, despite a lot of the disappointing and devastating things that happen in our life, it's being able to really see yourself in a healthy way despite those negative experiences, and being able to really navigate very difficult emotions. Now, a lot of people may think that the decisions that they make are really done from a logical or intellectual space, but there have been actually a lot of studies that find that a lot of the decisions that the average human makes is really they're really emotional ones. So as I was saying, this world, just living in life, we really can't escape a lot of very devastating, disappointing experiences. And those experiences really shape our emotions. And again, those emotions shape the type of decisions that we make. So we all know that the type of decisions that we make really has a great impact on the quality of our lives. So you can imagine people who, for instance, experience a lot of trauma, that definitely will affect their decision making, which in turn will affect the quality of their life, which in turn will affect the type of emotional wellness that they experience. So, using the example of trauma, there have been tons of studies that have showed that trauma actually changes the brain itself, the actual organ of the brain. And it actually can decrease a lot of the hormones in the brain that affect our well-being, such as serotonin, which is a very common feel-good hormone. So a lot of times trauma and adverse experiences will actually lower levels of serotonin to the point where a person really is unable to really recover their sense of emotional wellness. So really recognizing how negative experiences in our life affect our emotions and seeking the help for that so that we can live, healthy, fulfilling lives. That really, to me, is emotional wellness. And I look at it as less of a destination as I do it being a journey, right? Emotional wellness. It's something that we always have to pursue because life happens, right? Things just don't
Yes.
stop, right? We have disappointing events that happen, things that we can't anticipate. So I think it's really kind of having a pulse on where you are and really being self-aware and bringing alongside oftentimes a mental health professional to really help bring to light those things that maybe you are not able to kind of see how they're impacting you. So I would say, I know it's kind of a long answer, but that's what I would say emotional wellness is.
All I can say is wow and double wow. I mean, that's so amazing. Um, you're very knowledgeable. What made you get interested in mental health?
Well, I never thought I would do psychiatry. I always knew I wanted to be a doctor, but I never thought I would do psychiatry because I never felt it was like a real doctor, you know. But it wasn't until I ran into my own experiences in medical school with depression and anxiety. I actually struggled with depression and anxiety even as a teenager. And as depression and anxiety plays out, it's one of those illnesses that, you know, what we call waxes and wanes. You know, you have bouts and you get better, and you know, you go on, and if you have something else stressful, oftentimes you can fall back into a depressive state. So I was having some academic difficulties in medical school, and it just really sent me into a huge depression to the point where I took some time off school, sought out treatment, counselor, got on an antidepressant, and just saw how effective it was, and just fell in love with the field in that way. So, although it wasn't a career choice that I anticipated, I can see now that it really was always meant for me to do this because I absolutely love the field of psychiatry. I think people are fascinating. Learning why people do what they do, starting with myself, you know, kind of goes back to what I was saying about the emotional wellness, really having a healthy understanding of, you know, why do I feel the way that I do? How has my past experience influenced the way that I see myself, the way that I see others? So that was really my own journey, and just learning about the field in that way. So that's really how I came upon being a psychiatrist.
Oh, okay. You gave me a great segue. What is a psychiatrist and what are the educational requirements?
Well, a psychiatrist is a medical doctor. So a psychiatrist have pretty much has the same training as a primary care doctor or obstetrician gynecologist, in that they have also, you know, gone through and graduated from medical school. And then after medical school, instead of pursuing training in obstetrics or surgery, psychiatrists will go on to do what we call a residency program. So we basically focus on, you know, the field of mental health. So psychiatrists, like I said, are medical doctors. And we basically focus on the mind body connection. How does the mind and the brain affect what goes on in other parts of the body and vice versa? So that pretty much is training of a psychiatrist. So basically you have 4 years of undergraduate study, and then another 4 years of medical school. And then depending on how long the residency is, and for psychiatry, it's anywhere from 3 to 4 years. And then I also went on to get some training to work with children and adolescents. So that's another 2 years. So that pretty much is how that works in terms of a psychiatrist.
Okay. Now, forgive me for being ignorant. So, what's the difference between a psychiatrist, psychologist, and a therapist?
Yeah, no, that's a great question because a lot of people have that question. So, like I said, a psychiatrist is a medical doctor who went through medical school. On the other hand, therapists and psychologists do not go to medical school. They do have a lot of educational training, but it's not, I would say, medical related, so to speak. For instance, a psychologist is usually, they have the degree of a PhD, and that stands for Doctor of Philosophy. So they tend to have done quite a bit of research in a certain area within the field of psychology. So they have a lot of expertise in one area versus another. And they're generally skilled at diagnosing and offering treatment plans for patients who have a lot of mental illness. Similarly, therapists are mental health professionals, although they don't tend to do a lot of research. They do a lot of clinical work. For instance, you can have a therapist who's a social worker, and that social worker may specialize in treating families. So they may be a licensed marriage or family therapist, or you may have a therapist who specializes in treating substance abuse. There are some therapists who will treat people who've gone through divorce. There's some people who conduct group therapy. So therapists really could have a lot of different training, but they're basically offering what we call talk therapy, you know, helping a person think differently about themselves and about their environment and really challenging what we call cognitive distortions. So that's kind of the difference between those, but there is a lot of overlap there.
Okay. Now you were talking about you being a medical doctor, and we can talk about the primary care physician. Now, how do you support them, or how do you work together with a primary care physician?
Yeah, so primary care physicians, as you know, are just general practitioners. That's another name for them. So, you know, primary care doctors, they treat all kinds of illnesses from colds, flus, broken bones, those types of things. And they just basically help a person kind of maintain an overall general sense of health and well-being. Um, as we know, there is a lot of connection between people who have chronic illnesses such as diabetes, high blood pressure, heart disease, and them also having mental health issues, just because having a chronic illness really weighs on you. So oftentimes, primary care doctors will have patients who come into their office, and in addition to having some of the chronic illnesses that I just named, they may have depression. And sometimes primary care doctors may not have a lot of time to get into questions about their mental health. So they may miss some things. So what I like to do is to kind of fill in the gap and work alongside of primary care doctors to really help support and provide guidance on the mental health aspect of what their patient may be experiencing, so that myself and the primary care doctor can really treat, you know, the whole patient, mind, body, that kind of a thing.
Okay, thank you. All right, so are you doing it as yourself as a medical doctor, or you, because I have down here that you own Align Psychiatric Solutions. So
Yeah.
could you tell me a little bit about that business and who your clientele would be?
Absolutely. So Align Psychiatric Solutions is basically a consulting firm. So just as I described, you know, I would come alongside of a primary care doctor. And again, that could be just a regular PCP, pediatrician, obstetric gynecologist, and really assist them in finding the right medications for the patient. If that patient has, for instance, depression or anxiety, you know, if medications are needed, what is a great dose for that? You know, how long should that patient stay at that dose before maybe increasing the dose, those types of things. Because although primary care doctors and obstetric gynecologists and pediatricians are great at diagnosing and treating general health conditions, sometimes the knowledge is limited in terms of the psychiatric aspect of medication management and things like that. So I step in and assist in that way and really try to help to bridge that gap so that that patient is supported, not just from a medical aspect, but also a psychiatric aspect.
Okay. Now I know that, going to our primary care physician can be a challenging thing, especially if we have injuries that you can see. So why do you think people have difficulty identifying and understanding the signs of mental illness? Now, this is even before they get to the doctor. And why do you think that mental illness could be seen as a stigma, if you will?
Yes, absolutely. I think it really depends on the environment that that person grew up in. For instance, you know, I grew up in Detroit, inner city. Unfortunately, a lot of crime and a lot of unrest, violence, those types of things. And I think in order to survive in that type of environment, you have to develop what we call defenses, right? Defense mechanisms, ways to still be able to live despite the challenges of living in an environment such as that. So sometimes one defense mechanism can be to normalize things that actually aren't very normal, right? So you may have an uncle who, you can count on him to get drunk for every holiday, for instance. And, that might be described as, oh, well, Uncle Johnny, he just likes to have fun, quote unquote, right? But when Uncle Johnny drinks, he gets upset, he gets loud, he gets violent. But again, that's just kind of how, quote unquote, Uncle Johnny is. So it's almost like you're normalizing really very unhealthy behaviors and patterns that you see in other people. So Uncle Johnny, what the family probably doesn't know is that he's trying to deal with trauma from maybe his childhood by drinking, by using alcohol, by doing what we call self-medicating, right? So minimizing symptoms, misinterpreting symptoms as being something that they're not. I think that's how a lot of mental health issues get overlooked or people get misdiagnosed. Also, an example that I see a lot in my clinic is people who are depressed. Classic symptoms of depression are things like unexplained changes in sleep, energy level, appetite, concentration. The person no longer enjoys things that they normally enjoy. They have decreased motivation to get up and go. And if it's bad enough, they may have suicidal thoughts and or behaviors. And for instance, the decreased motivation and the decreased energy that's associated with depression, a person may say, what's wrong with me? I'm lazy. I need to be getting up and doing things, not knowing that it's actually an imbalance in their brain where there's low levels of certain hormones that really will allow that person to have the motivation to get up and go. So again, misinterpreting symptoms as being something that they're not is really a way that I think a lot of people miss, recognizing mental health disorders.
That is a lot of information. And again, that's something like you said, if you didn't grow up understanding these are the types of things that you would need to look for, I could understand where people might see this as, for lack of a better term, a stigma. So I know that you are very busy and I so appreciate your time. Is there anything you would like us to know? And hopefully we can have you back sometime. But in the meantime, is there anything you would like us to know?
Well, I think that just speaking a little bit on the stigma, which I didn't answer your question about that, mental health stigma is definitely a barrier for people to get in to see a mental health professional or even to reach out to a family member just to share with them if they're struggling emotionally. So stigma is really just it really is a negative view that a person would have of having a mental illness. A lot of people who struggle with, again, depression, anxiety, or even learning disorders, anything that would cause them to have challenges in thinking and functioning, would qualify as a mental illness. And a lot of people may think that, quote unquote, I'm crazy, there's something wrong with me, and that would prevent them from reaching out and asking for help. So my message would be there's actually a lot of strength in asking for help. That doesn't mean that you're weak. It just actually means that you're savvy and strong enough to recognize when you do need that extra help, because we all need help. We are social beings. We're meant for community. And without each other, we really aren't going to thrive and be able to live the healthy life that, we all aspire to live. So I would say get the help. If you need the help, don't be ashamed. Get the help.
Wow, that is so powerful. Thank you so much again for taking the time to speak with us, and hopefully we get to have you back.
Thank you for having me.